So the next video in this series of chronic Lyme disease is going to ask one more question. Can inflammatory joint disease be chronic Lyme disease? So inflammatory joint disease means that a joint gets swollen, it usually gets red, and it gets a little warm, may get really warm. So inflammatory joint disease is often thought of as more like rheumatological diseases like rheumatoid arthritis or lupus. But it turns out in this part of the country, when I see somebody with inflammatory joint disease, it's more likely to be Lyme disease than it is likely to be one of these other diseases that are disturbances of the immune system. So this is really important because when you start entering the evaluation for rheumatological diseases, it's very complicated, it's very expensive, and you might be led down the wrong path because you might have some blood tests that actually look like they're positive for rheumatological diseases. So if somebody has inflammatory joint symptoms and they haven't been characterized yet with a precise diagnosis, it might actually be Lyme disease. Now, again, the issue is a complicated one much of the time, and it needs to be made between a patient and their doctor. But I'm just simply raising the awareness that Lyme disease can present in so many different ways. It can present in any part of the musculoskeletal system, and it can present as joints that actually get swollen, they get painful, and they really impair function. So if you have something like that, it's definitely worth pursuing. Do you have chronic Lyme disease, and can you do something about it that's simple? And the answer is usually you can if that inflammatory joint change is from Lyme disease. So in the next video, we're going to start looking at different causes, environmental factors that play a role in chronic Lyme disease. And so click on that link and it'll take you to the next video. I wish you well, God bless, and have a good day.